So today we are going to discuss about the larynx. Here you can see a specimen of larynx, which is here. This is the anterior view. This specimen contains from above downwards tongue. Then here is the hyoid bone. This is the thyroid cartilage and cricoid cartilage, which continues downwards as trachea. Then this is a hyoid bone which contains two horns. We have a greater horn and a lesser horn here. Below that you can see some flap muscles, that is the infrahyoid muscles, and this hyoid bone is connected to the thyroid cartilage through a membrane called thyrohyoid membrane. This is here you can see the thyroid cartilage, which has got two lamina and an angle at the center. This is called thyroid angle, which is acute in males and 120 in females. So because of this difference, you can see a prominence of laryngeal prominence in male, which is known as Adam's apple. So here you can see the lamina, and the lamina contain an oblique line where some muscles are attached, and below the thyroid cartilage you can see a membrane again, that is called conus elasticus. Below that you can see a cartilage called cricoid cartilage. This is the only cartilage which forms a complete ring around the larynx. This is the posterior aspect of the larynx. Actually we have cut open the wall of the pharynx. Now you can see the inlet of the larynx, which is bounded above by the free margin of epiglottis. Here you can see a leaf-like cartilage, which is the epiglottis, and it is attached to the arytenoid cartilage, which is located over the cricoid cartilage. This is the posterior lamina of the cricoid cartilage. Above the posterior lamina, we have a cartilage called arytenoid cartilage, which is pyramidal in shape. And this arytenoid cartilage is attached to the epiglottis through a fold, mucosal fold. You can see the fold here. This is the array epiglottic fold. So the entire inlet is completed anteriorly by the epiglottis, or laterally by the array epiglottic fold, and posteriorly by the two arytenoid cartilages. And once we open the larynx, you can see the interior of the larynx. The interior of the larynx contains three regions. You can see two mucosal folds at the center, that is, they are vestibular fold above and vocal fold below. This vocal fold is the free lower margin of this mucous membrane, a fibroelastic membrane, which is known as chordrate membrane. And between the two folds, this is the vestibular fold, this is the vocal fold. Between these two, you can see a space. That space is known as sinus of the larynx. Here, the area below the vocal fold up to the lower margin of the cricoid cartilage, it is known as infraglottic part. So the entire inlet of the larynx contains three regions: supraglottic part, sinus of the larynx, and infraglottic part. This mucosal fold contains two ligaments. The vestibular fold contains vestibular ligament, and vocal fold contains vocal ligament. And once you see the larynx from above, here you can see this is the array epiglottic fold, which is extending from the epiglottis towards the arytenoid cartilage, which is located over the posterior lamina of the cricoid cartilage. On either side of this array epiglottic fold, and this is the anterior posterior surface of the thyroid cartilage. Between these two, you can see a space. This is called pyriform fossa. This is a common site of lodgement of foreign particles or food particles, and that may lead to infections, and that is the applied importance of pyriform fossa. Once you look at the anterior aspect of the larynx, I told you there is a membrane between the hyoid bone and the thyroid cartilage. This membrane is called thyrohyoid membrane, and this thyrohyoid membrane is pierced by some structures. which is the nerve supplying the larynx, that is the internal laryngeal nerve and superior laryngeal vessels. They will enter the interior of the larynx and supply the larynx. This epiglottis is connected to the tongue anteriorly. This epiglottis has got an anterior surface and a posterior surface. This anterior surface is connected to the tongue through two mucosal folds, one at the medial midline, which is the median glossoepiglottic fold, and on either side lateral glossoepiglottic fold. In between these two folds you can see two depressions, that is called vallecula. This is the anterior view of the larynx. This is the thyroid, this is the cricoid. On either side of the cricoid cartilage, anterior to it, you can see a muscle. This is the cricothyroid muscle. This is the only muscle, intrinsic muscle of the larynx, which is located outside. And here, this is the posterior aspect of the larynx, that is the inlet of the larynx. Here you can see this is the lamina of cricoid cartilage. On either side of the lamina of the cricoid cartilage, you can see some fibers. They are the posterior cricoarytenoid muscle. This is the only abductor of the vocal cord. Hence, this muscle is known as safety muscle of larynx.